So, hello everyone, and I know a few people are just joining, so welcome to the last in our conversations here around the theme of resilient health futures. As you will see, some of you who are joining us online are just saying hello and giving a name and where you're calling in from today in the chat, just so that we can get a sense of who is on the line with us and with our wonderful panel of speakers. I'm Laura Winn. I am head of the School of System Change at Forum for the Future, and I'm going to be hosting this conversation with you all today. So to start off with, just before we get into the content, I'd love to introduce the project, give a bit of context, and then our speakers, and then we'll get into a conversation together. So this is the sixth and final conversation in a series of dialogues that we've been running with the Forum for the Future Futures Center and partnered with the Johnson & Johnson Center for Health Worker Innovation. And the project aims to build a shared understanding of how COVID has impacted society. And we'd like to distill learnings about what that means for how we design, build and run more resilient community health models in the future. And this set of conversations has been running over the last few weeks. And this sixth and final conversation will hopefully help us bring together everything we've learned so far and also really focus on positive change for the future. And so you can find out more about all of the topics and inquiries on the Futures Center. I think we can share a link through there. And it means that you can go and look at the videos if you haven't done so already, and all the blog posts that go with all of our signals of change that we're seeing on this topic, and really get into more depth. And after this, we'll be really pulling together all of the insights and release a report on our findings, and that will also be available on the Futures Center. So, this conversation about, what would enable a more resilient health system to emerge for the future is obviously a really important one, but we recognize that what we're doing is only a small contribution to a much wider conversation that's going on at the moment. For example, even with the United Nations General Assembly happening in parallel at this time. So we really want to think of this as a sort of lively and futures-oriented conversation with you all. And I'm really pleased to have with us three wonderful speakers who are going to help us distill some of the insights that we've been having in these different conversations, and dig into some of the places where we can sort of see hope and change for the future. So we'll do a little round of introductions now before we go into the conversation itself. I'll start. That's sometimes how we do things at the School of System Change, modeling the kind of conversation that we want to have. And so, as I was saying, I am the head of the School of System Change, which is an initiative part of Forum for the Future to support change makers from across all sectors and across the world to become more systemic in the ways that they're addressing complex challenges. And so part of this work includes projects with the Future Center, which is our participatory digital platform for tracking trends and signals of change and making sense of what's emerging. A lot of what we do at the school is really help people try and understand all of the complexity of systems and also how they can work together to build communities and drive positive change. And so what I'll be asking is, for each of us as we check in to give a little indication of what this notion of resilience might mean for each of us. And so for me, this notion of resilience actually speaks to the capacity of complex systems and living systems. When I think about health, I think very much around how we're part of living systems as individuals, as communities, as our society, and also connected into the wider living world. And resilience speaks around how these living systems continually adapt and evolve in the context of a really fast changing world. So that's sort of how I'm coming into the conversation with this idea of resilient health systems of the future. And I'd love to invite our three panelists to join me on the screen, if that's possible now, just for this round of introductions. So welcome into our discussion. And Mathilde, maybe you'd like to go first, just a quick introduction, and then what this notion of resilience says to you.
Sure. Thank you for having me. And so my name is Mathilde Forslund. I'm the Executive Director of Transform Health. And Transform Health is a coalition of organizations working on bringing together a global movement to strengthen the political will, adoption and investment of digital technologies and data to transform health systems so that countries can achieve their UHC goals. And so I was reflecting on this, what resilience means to me. So I think a resilient health system is one that we can continue to provide, that can continue to provide essential health services in the face of an external shock or change. I think with the COVID pandemic, we've seen resilient health or resilient health systems really be tested around the world. And the pandemic has upturned, our past assumptions about which health systems are more resilient. And so I think the adoption of digital health tools can really help build resilience against future health emergencies by offering ways to provide and maintain primary health services, and by also empowering individuals to play a greater role in their own healthcare. So that's what I believe.
Thank you. Ben, did you want to say hello and introduce yourself?
Absolutely. So good morning, good afternoon, good evening, everyone. My name is Ben Davies. I lead global community impact for J&J in the Europe, Middle East and Africa region. And as part of that, also have oversight of the J&J Foundation that operates here in this region. Further to that, I also have a coordinating role for the Center for Health Worker Innovation, and that's where this partnership has led to. And really excited to be here in the panel today, but also, the broader discussion and all the conversations that have happened to date in terms of, what's the next normal and how are we building towards that? And I think, around resilience for me, it's such a big word. I see it more as an image to some extent, the wind blowing the tree in a storm that is kind of bending over backwards. And there's this phrase that says, the wind does not break the tree that bends, right? So how do you kind of extrapolate that to a health system? And how can you think about the kind of deep rootedness combined with flexibility, agility, being able to withstand those shocks that Mathilde mentioned, because they can come at any time, as we have seen through this pandemic. And I think, how do we invest at the roots, at the foundation level, at community level, empowering communities and creating such a strong connection into primary care? So thank you.
So Dr. Githinji Gitahi, did you want to say hi as well?
Yeah, hi everyone. I was just enjoying Ben's poetry. The wind does not break the tree that bends. I think that's a really good way to look at this. And thanks to Mathilde for this and connecting again. My name is Dr. Githinji Gitahi. I head Amref Health Africa globally. I'm based out of Nairobi, Kenya, but we have been involved in building health system resilience in the continent of Africa, where we work in about 35 countries, working with partners like Transform Health, working with partners like J&J, to just see how we embed digital health and we embed community health systems into building resilient health systems. And in which case then I would like to give my view about what resilience means, Laura. And in my view, I tend to think about health system resilience like it's what really Ben has said, that if you can bend and spring back, then it's unlikely you can be broken. But I like to see in the actual sense, it's about the ability of the health system to withstand or to recover quickly after unexpected events. And I like to think of it as running. If you're running on firm ground, that, on rocky ground, then you need a very strong soled shoe for you to be able to bounce back. So the resilience is built in the shoe because the environment is very kind of unforgiving. But you can also look at resilience in terms of protection and saying that you can actually protect the health system so that it has adequate optimal resilience. So because the resilience is not a point that you reach, it is actually a continuum, and therefore you can also protect resilience by building an enabling environment. That's what we are doing with the COVID response. When we are flattening the curve, we are protecting the existing health system resilience based on its level of resilience. So resilience can be seen in terms of achieving it both by protecting what exists or by building more of what you have. And that's why you can have a shoe with a bad sole for very good ground, or you can have a shoe with a very good sole for with a bad sole for very good ground. So I think we need to look at it both ways. Thank you, Laura.
Thanks, everyone. And what a lovely start to this conversation. So yeah, we're thinking about resilience, and we're understanding it as about the ability to withstand shocks and to recover quickly. But we've had these lovely images already that are kind of getting us into the reality of this. How do we bend? How do we adapt? How do we shift? How do we develop rootedness? How do we kind of create environments that can stay healthy, and how do we protect them in what might be quite an unforgiving environment? So lots in there that we'll be able to draw on over the next just over an hour that we have together. I'd love at this point to invite our participants. So thanks all of you who are calling in to respond to a little poll so that we can also, as well as hearing where you're coming from, hear a little bit more from you, how you're engaging with this topic. So we should be able to send that out to you now. And we're actually going to also disable the chat function and work together probably from the idea of a Q&A. So you can put your questions as we go through this discussion together into the Q&A. And noticing that we have with us together people from Zimbabwe, from Kenya, from South Africa, from the Philippines, from Peru and Brazil, from Canada and the United States, from Germany and Switzerland and the UK, and I'm calling in from France. So we've got a really wide set of people, and I'm hoping that that will really enable a fruitful conversation. Please also use Resilient Health Future hashtag if you're sharing on any of your social media. Thanks, Sidi, for just putting that into the chat. And do we have a result from our poll that may have come up? So we have 91% of people who've joined us today who say that they feel a sense of hope and agency with regards to the future of community health. So seeing that we are a very positive lot, and I'm sure that we are going to be able to increase that even to sort of see whether we can all feel really positive about this as we go forward in our conversation. So I'm going to invite our panelists, first of all, to sort of illustrate a little bit more, maybe less poetically and more tangibly, this idea of resilience, and also drawing out some of the insights that we've had from the previous 5 conversations, some of which you've participated in. So, what we were really hearing is that, during the COVID-19 pandemic, there's been a huge focus on the role of health workers, and more specifically in some areas, community health workers. And there's a big discussion on how we train and how we compensate and value community health workers. And at the same time, we've also heard in our insights that, actually, our community health system itself is not very healthy. We've heard about burnout of community health workers. We've heard that actually, by some estimates, we need another 18 million more healthcare workers globally by the end of the decade to fill the gap in demand. And so at the moment, we're running thin. And, we saw that this is actually quite tricky. So we've got hope and agency, but things are also quite difficult. And one of the challenges that we've noticed across these conversations is how to enable a sort of culture or mindset shift towards holistic health. And as systemic practitioners, we see that at both the level of individual people, so the patients who are needing care, but also actually the community health workers and as individuals who we've heard are exposed and exhausted, and how actually we need to articulate that sort of individual holistic health with the health of the systems themselves, which are struggling with a lack of healthcare workers and strong cultures of working in silos, so that actually, the information isn't circulating and decisions aren't being able to be made with, the best information that we could possibly bring in to make good decisions. And we're also hearing that there are barriers to innovation that prevent these systems to adapting to changing circumstances. And that's something that's come up immediately at the beginning of this conversation, where we've been saying, well, resilience is about bending to the wind. Resilience is about protecting and building up what we've got, but also adapting in the face of change. So I'd love to invite each of our panelists now to give an example, if you have one, of where you might have seen some of this shift towards a more holistic approach actually coming through in the work that you're doing or supporting. And that might be an example where, teams or health systems are starting to focus on holistic care for individuals, and or where we're starting to see that more at a community health level. And I'd love to give that conversation the opportunity to start with you, Mathilde, if you will. Where's somewhere that you're seeing a shift in mindsets towards something slightly more holistic?
Yeah, thank you, Laura. So I don't actually have a specific example to share, but I would say that by focusing on an individual, we can really tailor health services to meet the specific needs and bringing care to individuals where they are. And so, for example, in the case of HIV and AIDS, it was recognized that many people living with HIV were dying from other infectious diseases like TB. But HIV and TB services were available in different places at different times. And now there has been progress in making testing, treatment, and care for different health issues available in the same place, rather than people having to travel. And another example would be that I would mention is integrated management of childhood illness, where community health workers are trained to diagnose and treat a range of common illness that young children are vulnerable to. So what I think is that we need to invest in a strong primary healthcare system that can comprehensively respond to people's health needs where they are and when they need it. And I think the COVID pandemic has really accelerated a trend towards digitalization of health systems and services, where once there was resistance to digitalization, mindsets have shifted out of necessity, and we see a much faster uptake of digital health and approaches such as telemedicine and e-health and so on. And whilst these digital tools are never really they're never a replacement for community health workers, they can help to expand access to some health services, even in settings where health worker shortages is great. And it can also give people more choice about where they get their health, although there are obviously some drawbacks as well to digital technology. But you could, in theory, have a consultation with a doctor anywhere in the world, and patients can seek out best quality care. But on the other hand, it could also widen the equity gap with the poorest people not having the luxury of choosing the best care. So there are obviously drawbacks as well.
Thank you so much. And Ben, maybe you want to come in with an example that you've seen through some of the work you've been supporting.
Absolutely. And just picking up what Mathilde was saying there on kind of mindset shift and putting the individual at the center, the kind of reference I would like to bring in here is actually going back to one of the first conversations in this series. I was in a panel then with Brian Dow, who is the CEO of one of the organizations we're partnering with, together with operating company in the United Kingdom, which is Mental Health UK. And this is obviously they run multiple programs across the UK in combination with the NHS, etc. But I think one of the interesting areas here that Brian spoke about was also the kind of the biggest challenge for patients, mental health patients who are looking to reintegrate back into the community is it's very overwhelming. It's overwhelming, but it's also very vertical because there are so many different services that you can get access to, but none of those services are centralized. So they could be physical health, continued mental health support, could also be around housing, employability, education. These are all, run very much as kind of verticals in any health system, not only in the UK. So, together with Mental Health UK, the organization has actually looked at this gap and come up with a new model. And the model is kind of inventing, if you like, a new cadre of worker, which kind of spans somewhere between health and social care, which is a mental health navigator. And the mental health navigator really helps patients and other individuals coming back into society, into the community, to navigate that complex system so that there is better understanding and support on an ongoing basis to access sometimes what is, very bureaucratic processes, and sometimes a very kind of, it's not very human in many cases, is it? That connection into huge systems and services, etc. And I think, there's some really great examples that you can find on the Mental Health UK website of how this program is working. And I think also, really making a difference at the individual level, really putting the individual at the center and moving away from the verticalization and trying to see, how can we help support and build a more sustainable future for many people who struggle to deal with all these complex matters in society. So yeah, thank you.
Thank you. And then Dr. Githinji, I'd love to invite you to come and share an example from your part of the world as well.
Yes, I'm here. Thank you. Thank you very much. I want to look at this as, in a way, to look at the difference between the health system and the healthcare system, so that when we are discussing health system resilience, we are not necessarily confusing it with healthcare system resilience. So healthcare system resilience and health system resilience, in my view, are different. And the way we look at healthcare is through the building blocks of WHO, which is basically saying, is the healthcare system resilient enough in terms of it has enough service delivery capacity to, to take a surge. We have seen that significantly challenged in the COVID situation, where we didn't have enough ICU beds, we didn't have enough, hospitals and beds and all this kind of thing. Then you look at commodities, oxygen has gone up, 8 times. So was there enough resilience? You can look at the entire system of the healthcare system and say, each of these building blocks needs resilience, and that resilience is dependent a lot on resources and the financing and the data that's available. You have to look at all those things and say, what do we need to do to create this resilience? But when you come to the health system, I like to add people to the health system, because the healthcare system is more supply side. It's more the garage. When people get sick, that's where they go for service. But actually, the health system is more the continuous maintenance. It shouldn't be built in the healthcare system. And this community resilience, therefore, the health system resilience is dependent on the resilience of the community. It's actually embedded in the community itself to be able to keep away disease, to be able to stay healthy, and to be able to respond. And they need to respond by being able to know exactly what to do when. We saw this very challenged by information, that when you wanted the communities to be, the health system embedded in the community to be resilient, the communities asked to do what? We say to take vaccines. Why? Are they safe? Are they not safe? Why should we take them? And whereas you may have enough supplies in the healthcare system of vaccine and health workers, vaccinators, and of course my colleagues have reflected on the challenges on all the other building blocks, not enough health workers and all these kind of things. I think it's important for us to look at health system resilience as embedded in the community, as embedded in the people. Now, this starts to speak around the primary healthcare structure or the primary healthcare framework, which talks about the primary care, which is what we can see as the healthcare system, but then talks about community empowerment on one side and talks about multi-sectoral approaches on the other side. Now, if I look at examples, Laura, I am reminded of, there are many examples, because the first thing I need to say is that resilience is local. It happens at the most local level. It doesn't happen globally, doesn't happen regionally, doesn't happen nationally. Resilience happens at the health center, whether the health center is able to respond to the shocks. And once you have that unit as a unit of resilience, and then you have multiple resilient units, then you can see you have a resilient national health system. That's the way I like to look at it. Now, as an example of building resilience through multi-stakeholder action and looking at changing systems, I'm reminded of a visit I made to Ethiopia some time ago. And I went out to the field with the Minister of Health, the former Minister of Health, who is Amir, and he took me through this model that Ethiopia had developed, where they said, what if we just looked in a district, looked at the individual needs, not the healthcare system needs. And we say, if you look at the individual needs, education is critically important to reproductive health services. And the more educated a woman is, the more likely that they're going to adopt family planning practices. And what about the need for electricity in ensuring that the cold chain is properly maintained so that you can achieve vaccination? And what about access to the facility when you need to be admitted? And there is, all these areas. What about the road when you need to take your child to be vaccinated or even for urgent care? And what Ethiopia was doing then is to say, if we look at that human-centered approach, then we need to get these ministers together to have a common investment plan into health, not into healthcare. And therefore, you had this approach in Ethiopia, which they're still doing now, testing district by district, where the Minister of Health can actually allocate budgets to Ministry of Energy so that some particular facilities can access electricity, and allocate money to the Minister of Water and Sanitation to ensure that those facilities have water, sanitation and hygiene, because it's necessary for effective maternal and neonatal care. This is a good example that I saw of community-centered and starting to change behavior of the way people see health system resilience and health resilience itself. Back to you, Laura. Thank you.
Thank you. And very rich there, because we're seeing, I guess, this balance in all of these examples that you've given between, really taking a human-centered approach and a local approach, and then also the unwieldiness and the complexity of how people are embedded within their district or their community, but then also within, these much wider systems, which are often governed at a different level. Decisions are being made that affect people on a very local level, at a level that is, perhaps of regional, if not national, if not sometimes international, government and decisions. And when we're also layering on top of that, it's not just health, it's also education, it's also energy, it's also, perhaps housing and other social issues that we reflected on as well. When we're talking about mental health, it's about how people live their everyday lives, not just when they're in a sort of health crisis. And so how we can really work with these multiple levels, keeping people and that really micro level central, while also really thinking about the enabling environment. And that's a question that came up for us actually when we were looking at the insights in our previous conversations here, which I'll say again, you can look at on our Futures Center. But we often kind of zoom out to that bigger layer in order to see the patterns and understand the challenges in their wide context. But, you know, it's really difficult to also shift mindsets at that level, you know, and try and work with, you know, policy or advocacy or whatever it means to really work at that bigger level to enable change. And so I was wondering whether you have examples of, you know, where we're getting that balance right between focusing in on the individual and also being able to work with that wider complexity and some of the decision making happening at that much higher level. And perhaps, seeing as you're here, Dr. Githinji, we'll have you respond first and then bring our other panelists back on this question.
Well, I think I'm seeing a lot of challenges in this this approach that you're describing. On one hand, I think that the way we've kind of created our health system in Africa, I'll comment about Africa, is based on healthcare systems and is based on building the WHO building blocks, which don't include people, they include supplies. And therefore, it has been difficult for governments to actually invest in this community level resilience. And we have seen, of course, examples. I've given an example of Ethiopia. We have the health worker extension model. We have in Kenya, we have many counties now, because health is devolved. We are seeing specific, you know, counties away from the national government building their own models of community health workers. We are seeing these things going on. But I think the most important thing is, how do we enable local autonomy and community accountability for us to start building this thing? Because the communities, Laura, know exactly what they need. We may see it as policymakers, but at the end of the day, the resilience is embedded in communities. And we have seen even for COVID, communities don't wait for us to go and help them. By the time you get there, communities have found their own solutions. So the question is, how do you facilitate agency at this community level so that the communities can actually be able to offer their own resilience, offer their own response, and the rest of us are just coming to support that. But you know, if the communities are dependent on national mechanisms and international global health mechanisms, then resilience is not going to happen. I was giving an example. I was at the Biden meeting, the global COVID-19 summit, and I was giving the example and saying, at this time we're speaking, there must be a nurse somewhere running to the store to look for PPE. And at that point, that nurse needs PPE. At that point, they cannot call Global Fund, they cannot call Gavi, they cannot call USAID. They need the PPEs at that point. And at the same point, there's a patient who needs oxygen, and the nurse will run to the store to look for the oxygen. And at the same point, there's a patient, a person, you know, a mother, a pregnant mother who is gasping and is at home and needs a community health worker to come and pick them and tell them, this is where you need to go. I think you need to go for your, for oxygen supplementation in this facility. And because you may have COVID, this is how I'm going to facilitate your movement. Those decisions are so local, but that is where resilience is built. It's built at the local decision making. And everything we think about in global health systems must be to facilitate and strengthen local decision-making mechanisms, including disease surveillance, and starting to see syndromic and being able community health workers saying, you know, there's something going on, there must be an issue, therefore we have to report to the National Ministry of Health. This is where we need to embed the resilience agenda.
Thank you so much. And Mathilde, I'd like to invite you back here to speak a little bit about, you know, what is the role of digital as well as part of this enabling and as part of how we can articulate what's really needed at that local level and at the individual level, and then, you know, into wider complexity.
Yeah, thank you, Laura. I think, I mean, there's a number of shifts necessary. I think in the way that we think about health and whose responsibility it is, digital technology really has the power to put all of us in the driving seat, and to ensure that, like I said before, that we really are primary carer of ourselves, but also the ones that we love. So to enable this, we really need to access the right information and in the right manner. I think that there's the way that we think about what we expect from frontline health workers, particularly primary healthcare workers. And increasingly, I think their role in a digital world is going to be to collect and interpret, data, and this is going to lead to some frustrations that they will not have time to spend with patients and so on. So I think we all need to consider the way we develop and procure and roll out digital solutions. Oftentimes solutions are commissioned and developed and integrated by a specific department to respond to specific health challenges or needs. And I also think that product developers and researchers and health system managers commissioning digital solutions need to consider the implication of introducing new technologies on frontline health staff to ensure that they're not being overburdened by new initiatives and different tools. I mean, there's like a myriad of tools out there that, and there's causing a lot of fragmentation. So we really need to think about a comprehensive systemic approach to the digital transformation of health systems that needs to start from the human experience and really centering on the individual, both that of the patient as well as that of the frontline health worker, to really enable them to provide the best care.
Thank you, Mathilde. And Ben, perhaps you can also share your thoughts on how we get this right in sort of the individual, the humans. I love this idea of we are the primary health workers of ourselves and of the people we love. And then embedded in our communities, we are also reliant on community health workers who have so much to do. They're running to the store, they're putting data into all of these new apps that have been developed independently by different departments. What are some of the ways that you've seen it work well to really take that human-centered approach, Ben?
Yeah, I think, first of all, it's a really good and great conversation. I think it's a really difficult question to answer because it's so multifaceted. I think, to what Dr. Githinji was saying is that resilience happens locally. That's the unit of analysis, right? But at the same time, we're all operating in a global system, right? So it kind of reminds me back in the days of, back in the student days of studying the agent structure problem and challenge, right, is who is affecting who. So if you build up, like Dr. Githinji was saying, the units of analysis that can kind of affect and create that change in the system, but at the same time, is the system or the kind of international layer, the global layer, they're ready to make that change? And so how do you kind of model that behavior? How do you model that change? And I think, there might be some interesting learnings to be taken here from the climate change movement, right? Which is setting some very, big goals and garnering, political will around, zero carbon economy by 2030. But, you see the individual movement around that, on the streets. Why don't we have that in health? Why don't we have that around universal health coverage? If you look at the statistics and the data, it's as challenging, isn't it? So, these are huge matters. It kind of just disappears into the complexity of health systems, I think. And many countries and communities are very much left alone, I think, as my colleagues have mentioned here. So I think, what this raises for us, as a kind of a funder in this space is, what is our role? And where can we play a role in that system? And I think here is, if you kind of look to who is at the center of a relationship, of a partnership. And we've done quite a lot of kind of soul searching over the last 18 months, 2 years as the Global Community Impact Team to understand, well, where do we belong in this system? And what types of partnerships do we want to be able to be part of moving forward? And it's a little bit around kind of giving up a proprietary relationship and looking to help convene and bring together multiple actors that are dealing in complex situations, because no one intervention, I think going back to what my colleagues have been saying, will be enough. You need multiple interventions. You need multiple organizations who can drive different levels of value. And I think that is a real existential question, I think, for all of us operating in this space. And I think, how do you remove yourself from the center, but play a very important role in that kind of ecosystem for change? And I think here, coming back to the the points being made around, some of the challenges that my colleagues mentioned, going back to thinking about new models, like the Mental Health UK approach. How can we kind of galvanize that more? How can we showcase that more? How can we push for change and kind of create this top-down, bottom-up dynamic with a sense of urgency? I think it's a real, how do we get that movement with sense of urgency, which I think we all need, especially around the universal health coverage space. So I don't have the answer, but there are multiple touch points. And I think, there is, I would say, a greater level of willingness and humility, I feel at the moment, among different actors in the space. And I think, the pandemic has kind of been positive from that perspective, is that there is more of a horizon, coming back to your poll at the outset of the session as well, around, what are the different ways we can collaborate? What are the different ways we can be thinking? Where do we need to leverage for change? And I do feel that there is a kind of a huge opportunity for that at the moment, but I don't think it will be there forever either. It's very easy to fall back into old ways of doing things. So we have a unique opportunity at the moment, I feel.
Thank you. Yeah, that's lovely to hear, and sort of takes me into the next question that I had for us, but I wanted to pull out this idea that's come through all of your responses here about really this idea of removing ourselves from the center. And so those of us who are used to making decisions or having the power to choose, actually shifting, and Dr. Githinji, you talked about, communities are building their own responses, and actually we as, as the health system around them, as perhaps the wider community, perhaps as the government or as funders, people who have resources, we're really here to support them. And I'm hearing that as well from you, Mathilde, around, digital's not the be all and end all. It's not, the purpose isn't to collect data. The purpose is really about enabling others and supporting people who really are at the point of care and struggling with what they need to do on the ground in those day-to-day, in those individual situations with people who are in need of care, that really it's this shift to thinking, okay, well, it's not about us having that power and making the decision. It's really about being in a supportive role and being in service of these communities who are building this resilience at this local level, district by district, and really attuned to the contextual differences, although perhaps some of the ways we can enable that can really benefit from the global resources and connections, and also creativity and innovation that's happening elsewhere in the world. And that sort of brings me to another question that we had, which is, really trying to understand how we can, find that agency for change and that creativity that is showing up in these communities who are really kind of designing and building solutions for what's needed on the ground. And often, when we're talking about systems change, we really recognize that it requires different kinds of thinking, and in particular dialogue with multiple perspectives. And you spoke to that just now, Ben, saying, you see that actually one of the roles you can play is some of the convening between actors who perhaps aren't talking to each other. And we heard about examples of, siloed services, or which are very difficult to navigate. And this is really what we've been trying to do as well with this conversation series, is really, hear from people in very different places in the system, and try and bring in those multiple perspectives, which give us the creativity necessary to get down to action and create change, from wherever we are in the system. And so I just had, this question to lead us before we go into an interaction with our audience here around, what gives you hope for that? Where are you seeing, agency for change and real hope around how we might use this moment, this opportunity that you just spoke to, Ben? And why don't you speak to that now while you're here on screen with me?
Yeah, no, absolutely. And I think just kind of picking up on that environment that we find ourselves in, I think there is a lot of kind of soul searching going on by individuals for sure, but also, organizations. And, probably, one of the big learnings that we have taken on board, which kind of creates a model. And, there's a partnership that we are doing with Amref in Kenya, which is around creating a platform for community health workers. And a platform in this case is really bringing together and convening different actors around to build the capacity and the integration of community health workers into the health system in Kenya. And I think the kind of approach taken here was very different from the kind of off-the-shelf solutions. And I think it takes a lot of trust among different partners to come together. I think that's the starting point. And then, willingness to collaborate across different actors, right? So from the WHO through to multiple NGOs, through to the Ministry of Health, to ourselves as, private sector funder, which is, I just highlight that, not always an easy position to be in either, from a trust perspective. I'll be very honest about that. But at the same time is, kind of from a program design angle, and, I think my colleagues have mentioned that multiple times, just how important it is to put the individual at the center, really kind of build from there. So from a programmatic design, human-centered design, then look at the different interventions you can have. And I think creating that level of collective impact, it's a huge word, right? Collective impact, measuring it is obviously challenging, but it's a dynamic as well as a way of measuring change. And I think, there's the kind of mindset shift that also questions the role that we can play as a funding organization, not the funding organization, to kind of help convene, facilitate. We have such a long history of multiple relationships and partnerships, across the globe, right? So, but of course, also from a private sector perspective, what are the additional competencies that we can bring in? That could also be through skills, knowledge, networks, product, etc. So, there's a lot that we can bring into the equation. And I think it's about understanding those systems, taking a step back, looking at a program design perspective, very human-centric, looking at who are the right actors around that. And I think digital obviously being a huge opportunity for scale, undoubtedly. But I think it's work in progress, I would say. But that really gives me and our team a lot of hope, because I think it just for the funding that we are making available, it will hopefully be able to create a more sustainable solution to the future. And also, I think the role that we can play is also to help bring on board and with us other private sector actors, and there's a whole area there that we are certainly looking to explore and galvanize on as well, so that you can kind of create a much more collective approach. Long way to go, but certainly some good early indications, and a big thanks to Dr. Githinji and his team, particularly for the work in Kenya around this. It's been a great learning experience.
Thank you, Ben. And hearing, really the relational quality. So we've been talking about humans, but really what's coming out for me is this hope that there is in the ability that we have actually to build relationships and learn from each other and really move forwards together. And that's brilliant. Mathilde, I'd love to bring you back in at this point and hear where you're seeing hope, I guess, and where you can see that there's agency for change. And, Ben said digital will be a huge part of what's coming up. So where in that, that world of digital health are you really seeing that sort of little spark of hope come through?
Yeah, thanks, Laura. I think I agree with my fellow panelists, but I do really see a lot of agency for change at all levels, from the individual really using digital tools in their communities to manage specific diseases, to regular reminders for patients to go for their appointments and checkups. to primary care workers using telemedicine to consult experts on the other side of the country or other side of the world, maybe in some instances. So I think we're seeing a tremendous energy, across both the individual level, but also, in the private and non-for-profit sector, with technology solutions being developed to address different health challenges. And we're also seeing, technical teams across, ministries of health that are really embracing digital solutions and developing their, national digital health strategies and so on. I think where we're seeing less engagement at the moment, and this is an area where Transform Health is really wanting to advocate and campaign, is among the political class. So politicians really need to get behind the digital transformation agenda as the resilient health system of the future. And we will need to operate under a legislative and a regulatory system that enables and incentivizes interoperable systems and that enables people to gain greater access to and control of their own health. And their records and their data, and to really be able to manage their own health and well-being. So we need to have a public conversation about how health information and knowledge is packaged and promoted, and to be able to people to make their own informed choices. And then we also, of course, need to convince politicians that we need to invest in community health systems and eliminate the huge funding gap that stands between a more equitable model of health for all, and particularly in Africa. And so, as we have seen during the COVID pandemic, community health workers are critical for the pandemic response and can be integrated into the public health system. And so we need to provide essential routine care when the pandemic ends. And I think community health workers really play a very essential role in that, and also in the digital revolution. So I think, from Transform Health, we are a coalition of organizations, as I mentioned before, really bringing together a global movement to strengthen the political will, adoption and investment of digital technologies and data to transform health systems. So we really hope to this is an area, especially around the political will and increased decision-making and investment in these areas. This is an area where we really want to leave a mark and continue to advocate.
Thanks so much, Mathilde and Dr. Githinji. And I'll bring you back in here as well. I think all of what we've heard is resonating very much with some of what you were saying earlier about the importance of really enabling what's going on with this local resilience, but that's connected up, whether it be connected digital or whether it be connected into this decision-making and political sphere. And where are you seeing hope for that in the work that you're doing? Where are you kind of seeing that agency for change?
Well, there is quite a bit going on, Laura, and both what Mathilde has said and Ben is true. So on Ben's point about systems change for community health units, for many of the people listening here, it's good to just paint the picture that within the health system in Africa, in many countries, starting from the top level is level 6, which is the topmost, and then you come down 5. Level 4 is the district hospital, which would have surgeries and everything else. Level 3 is the health center that caters for maternal and child health. Level 2 is the dispensary. Go and pick your medicine, maybe take your child for vaccination, no maternal services. But level 1 is community health unit. That is non-facility based. It is actually a unit of the community, which is facilitated by a community health worker or a community person who is appointed by the community. Then we train them to understand health dimensions, but they stay and live with the community that nominated them. So they're not posted away as health workers. They work with the community, meaning that they're actually embedded in the community that supported them. Now, what we are doing with the CHU or Community Health Unit for UHC that Ben talked about has many wins. One is structuring these community units and supporting them to be able to do the work they need to do, which is to serve the community, to be able to respond to the needs of the community. We are seeing successes there. I was just looking at what has been achieved on this particular program. We've been able to bring in data, for example, community health information system. I will just show you, Matilda, if you allow me. Let me show you something here. I hope you can see it. Can you see that?
Yep, we can see this.
Good. So this is what we call a chalkboard. This would be found in a dispensary, which is level 2, or would be found in a health center, which is level 3. These are where the nurses, ideally you would have nurses, you'd have midwives, and if you're lucky in the health center, you may have a medical doctor. But then the level 3s and level 2s would be nurses. But then the nurses work with community health workers or community volunteers. We don't like to call them volunteers because it gives the point that actually they can work for free. And there is a big movement now, which even Matilda is talking about how do we get the buy-in of politicians and also the ministers of health and the ministers of treasury or finance to pay community health workers so that they actually are part of the formal system. The data you see on this chalkboard is collected by community health workers from the households, because they're the ones in charge of the house. Each of them would look over maybe 100 households, depending on the sparsity or the density of the population. And where the density is lower, maybe up to 200 or 150 households. And they will collect the data, and that data would be the population. They would know their population. They would know many things, including child mortality, who is on antiretrovirus, which mother is pregnant, which child has what level of vaccination, family planning. They would have all that. And then they would visit the facility every week, and they would together populate this chalkboard. This is the lowest level of data systems. And once people and the organization like Transform Health then, support so that we have electronic community health systems, then the chalkboard becomes electronic. And therefore, each community health worker who has their phone would just load the data. It will aggregate to a dashboard, which then is on a screen at the health center, and everyone can see what's going on. And that's resilience because the data is live. Normally, what happens is in many of these instances, Laura, the data would be loaded, if it's not on this chalkboard, would be given to the district health information officer, who would then load it into the district health information system and would disappear into a dark space into the Ministry of Health, and the community would never see the data they gave. So even if there was a malaria outbreak, the community cannot respond because the data from the community, the district health information system, never comes back to the community. So we are starting to see initiatives like this, helping, of course, therefore, when we get together with people like J&J, and now we have seen Alma Philanthropy join the partnership, which is important because J&J started off, had the courage to start, and we have seen now this moving county by county, looking at certification of community health workers. So we are seeing movement. But let me also mention two other areas of movement that we've seen. One is that recently, when I was co-chairing the UHG 2030, we put a bit of pressure on WHO to get together with civil society to develop what does social participation of civil society in health decision making look like. And we had this handbook that was launched, the Social Participation Handbook. And that handbook helps you to understand what is happening in Iran with the National Health Assembly that actually collects views from the bottom. What is happening with the societal dialogue in Tunisia? What is happening in Thailand with what they call the triangle that moves the mountain, which is about getting public and civil society and starting dialogue from the bottom, so that decisions are not made in the boardroom of the Minister of Health. And we are seeing how do we bring this societal approach that we have now studied and actually documented in the Social Participation Handbook to Africa, so that we facilitate civil society to actually engage from household upwards. We obviously, 2 years ago, also have the WHO guidelines for optimization of community health workers globally. Those guidelines give a very good view, case studies, what works, and have given guidelines about how to optimize community health workers. Again, that's a new tool, which is a political tool, again, 2 years ago. The next thing is that we also now have the Global Coalition for UHC. What I have seen is that vertical groups like maternal health, child health, sexual reproductive health, HIV and AIDS, TB, malaria, non-communicable diseases, globally have now finally said, let's get together to a global coalition for universal health coverage, so that we advocate together for this resilient, community-centered health system, which will benefit each of our different agenda. And we are seeing that moving on. And finally, we now have some guidelines for parliamentarians, which is the point that Mathilde made at the end, that Parliament must be at the center of this, because they're the ones in charge of legislation. And if they're not in the center of operationalization of community health systems, operationalization of financing for UHC, then we'll not get far. So recently, there is actually a handbook for UHC for members of parliament. So there is a movement, Laura. The question is how we accelerate it, because if we don't accelerate it, the next pandemic is going to find us unprepared.
Thank you, and that's so inspiring. I'd like to invite all four of our panelists at this point, because we've got some great questions as well coming from participants, and if we can have Ben with us as well. But I just wanted to also, notice that actually our conversation already has really shown how we're finding hope in different ways that these systems are operating. And one of the first ones that we heard around is really about sort of posture or being, like how are we and how do we show up? And we heard quite a few things about, we're showing up with humility. We're showing up by trying to, remove ourselves, even if we're powerful actors or, private sector, government, funding. We're removing ourselves from the center, and we're trying to center, the humans and the patients and the individuals and the communities, rather than those who have, traditionally the decision-making power. So very much around the posture and the way we're showing up, and what we might even call, being. How do we want to be in the world? And we're also hearing hope around new functional capabilities, so new effectiveness of the systems we're working with. Particularly, we just heard about, live data, so that we've got feedback loops, and we've got, the functions that mean that actually we can aggregate, but also people can work with the data. They can see where it's gone, and they can actually then also build their own response to that data, rather than having to wait for someone who's suddenly, aggregated it to come back 3 weeks later when the crisis has passed. And we're actually developing that sort of effectiveness and those new functions in the systems we're working with. And then there was another piece, which is really about will, and almost like the political will, but also how we build the ability of civil society and other actors from the private sector, from government, to work with politicians and decision makers, and then build that will collectively to create change. So there are these sort of three different aspects that I'm noticing in how we're kind of finding that hope, and what's wonderful is to hear through your stories how they're coming to life together, and that actually it's those new effectiveness coupled with new will for change, but also with a way of showing up a bit differently that's really going to be making a difference in the next while. So I'd love to, give us the opportunity all together to respond to some of the questions that we've seen coming in from our participants here. And one of the first ones that came in and that I think's really interesting is that we're talking about empowerment. And so there's something here about how do we, cultivate a mindset shift in the way everyone in these systems are thinking about themselves. And so, how do we actually shift the way that everyone is thinking about themselves, and therefore empower communities not to be just recipients, but also to really, build their own response, as we've heard through some of this. And I guess the question that we have here is, what's a good way of going about that? How often empowerment can be seen as well as something that does have its difficulties in terms of an approach. So I wonder whether any of you have an experience or words to talk about, how do we really empower that at the community level? And we've started touching on that already. And feel free to just jump in here, because we're just...
Maybe I can start. And, yesterday I was talking to some colleagues, and somebody gave me a very clear analogy. They said there was this woman who was training her child to learn about traffic lights, red, green, amber. And every time that, that's a child, after a lot of training and traveling together, say, when do we move? And the child would say, When it is red, that's when we move. And the mother would say, no, we've talked about this over and over again. And they finally actually found out that the child was always on the back seat with a headrest in front of the child. So the child never saw the traffic lights the mother was seeing. The child was seeing the traffic lights meant for pedestrians on the side. So whenever the traffic one is red, the pedestrian one is green. And the analogy was used to show that you always see from where you're sitting. And if we don't allow communities, who are the ones who are living with lived experiences, a mother who lives in a house maybe will live in that house with probably the danger of cervical cancer, with a teenage daughter who is pregnant, with a husband who is hypertensive, and without any form of health insurance. No policy maker can see that perspective other than that mother. So until you bring that voice to the room, and these are the societal dialogues we're talking about. So for me, Laura, we have to find institutionalized mechanisms for engaging civil society. That is really what we need to find. If you don't have institutional mechanisms, then it's tokenism policy, which will never really respond to the needs of the people we're trying to address and who have the lived experiences.
Yeah, I think if I can, oh, sorry, Mathilde, please go.
No, go ahead. I go after you. You want me to go? Okay. So I can only agree with Dr. Githinji. I think he makes an excellent point. I think we really need to focus on bringing in communities and especially young people and women to really design the future of their own health. I'll just kind of give an example of something that we are working on at the moment, which is actually not related to Transform Health, but a number of foundations, including Foundation Botna, Merck for Mothers, and the World Bank, came together to design a new frontline health prize. So we actually, this is the prize that has been designed, and the design process began with a focus on addressing pain points of frontline health workers, and then a potential winning solution will work to the benefit of community health workers. So the prize is looking at identifying the most scalable way to increase capacity across an entire medical system, and looking at data infrastructure integration, which is what Dr. Githinji was speaking about and gave a really good example. Which would then lead to better health outcomes at point of care, from the hospital to the front line. So with this prize, we hope that innovators will focus on addressing a particular primary health need of a country by focusing on a particular care area. And the solutions for this prize will then be evaluated on the ability to scale to meet all the priority needs, in a particular country or a municipality or whatever it might be. So this prize we're hoping to kick off next year in Q1 of 2022. We've already gained quite a lot of funding for this prize. We're looking to launch it. We have a bit of a funding gap still of about 3 million, but so if anyone is interested to come on board and work with us on this, I think it's a really awesome opportunity of bringing in the kind of community aspect and really designing a resilient health system for the future.
Yeah, I just wanted to pick up on the point around building civil society or strengthening civil society. I think, in a health system, there's so many different actors, so many different, agencies as such. And I think, one of the areas where we have worked with partner organization is in kind of helping to establish, grow, and professionalize associations, so nursing associations, for example, across East Africa. And I think, this is such an important kind of professional association that stands for, the further education, training, representation. It's not a union, but, it's a representation to some extent of furthering and advancing, a particular cadre of health workers. I think that's something we shouldn't forget about, is the kind of support around resilience of frontline health workers through the support mechanisms that, associations can also create. And I think it's something we tend to forget in that kind of, recognition space, respect space, and I think, lifelong learning and representation as well.
Yeah, thanks all. And I think that links really well into another question that we've had here from the audience, which is around, and we touched on this in different ways, but around how we also need to factor in, wider systems than just health when we're talking about change in this space. And the question here is particularly around, what is the role of education and, with the link to health. But I think there's also, you brought in, Ben, the question around the climate movement. And we heard also around, the idea of, energy to be able to keep the cold chain and bring vaccines to communities. And obviously digital is also, we've talked about a lot, but it's also a whole system which needs enabling. And so I guess the question here is, how are these external factors, how impactful are they, and how necessary to address these things together, I guess, as we design forwards?
It's a big question. I can try and attempt to give some reflection on it, as maybe not an answer, but I think the social determinants of health obviously span multiple areas, which include, or determinants of health, maybe it goes beyond just social, right, which will in effect think about the link between education, growth, career, income, the economy of communities, let alone nations. I think the link into the environment. So if you see some of the trends that are coming out, from the UN, and you see, what's going to be the biggest driver of migration into the future, which will impact all health systems, undoubtedly, it's probably less on the political side and more on the environmental side. So, all of this is so extremely interconnected. And I think, what are the interventions we can be looking at here? I mean, they will be just so multiple. So, there probably does need to be, just looking at my own organization, even greater connectedness between the different areas that are working in this space around education, health, environment, the overall sustainability piece. So undoubtedly, I think, looking at some of the questions here and looking at, potentially some new areas of innovation, how can we, maybe build a repository to some extent of best practice? And I think, we can't, just as we're saying, we can't be, kind of going about this alone in many ways in health systems. Yeah, how do we connect it across the environmental side, the education side, and look at those determinants overall and understand the complexity of that. Huge undertaking, undoubtedly. But I think that's also what, the Sustainable Development Goals have been put in place for. But there are so many KPIs around them, right? So, we can't do it all, but I think connecting the dots between them is definitely a first starting point. But love to hear what my colleagues think as well.
Laura, what would you like me to comment on? I have heard what Ben has to say, just something that's remaining in that framework, because I think the conversations we had earlier, even if I think the point is to remember that, as I talked about earlier, the framework of primary healthcare as defined Almat, and then we looked again at it later in Astana, was very clear that primary care is only one part of primary healthcare, only one part. And the other part is empowered, educated communities, especially women and girls, because then you reduce the gender equity gap. And then on this other side is multi-sectoral action. And that multi-sectoral action means that if you're talking about climate change, it affects a household, because if you continue using solid fuel, then the rate of child pneumonia goes up. So the conversation around there for cases of pneumonia for Minister of Health have also to do with the Minister of Energy and how soon can we adopt renewable energy for households, Then you're talking about water and sanitation. If you look at the UK example, the biggest win for the UK health sector was actually the sanitation law of about 1940 or even earlier than 1940. That's what reduced communicable diseases significantly, through Chadwick and all the people who are working on that system many years ago. So I think the conversation around the interconnectedness of the social determinants of health, but also it extends for communities like ours, it also extends to women empowerment. Because when you don't empower women, then you end up with disproportionate economies, and you end up with gender-based violence, you end up with mental illness, you end up with teenage pregnancy, and teenage pregnancy pulls back communities, because then you end up with a very high dependency ratio. And in fact, yesterday in the World Contraception Day, in my view, the person who must pay most attention to contraception is not even the Minister of Health, it's the Minister of Finance. Because if you don't have adequate absorption of family planning, then it is actually a socio-economic failure. It's not a health failure. You end up with very high dependency, early pregnancy, early first child, and therefore you end up with the intergenerational poverty. So I think the interconnectedness is irrefutable.
Yeah, Laura, I can only agree. I don't have too much else to add, but I think, that what Dr. Githinji has been talking about, that interconnectedness and that, political also decision-making at multiple levels, it's not just about the Ministry of Health, it's about, Ministry of Finance, all kind of areas coming together and really working on this. So, yeah.
Absolutely, and seeing that just in what you're saying at different levels, how do we work with communities to understand the interconnectedness of the issues that they are working with, but also work with politicians or with governments to break down some of those silos and also see the interconnectedness between the different issues that they are focusing on. So really a capacity for all of us to develop in terms of understanding and working with complexity in this time. And we have just sort of time for one little last round here. And we wanted to take it a little bit deeper. I guess there's something here that we heard about this being a moment. We've talked a lot about, this opportunity that we have, and some of the hope that we're seeing is really around, shifting power, empowering communities, really focusing on people. I love this idea of, we are the primary health workers of ourselves, of our loved ones, and then there's also the community around that, and how do we value it? Dr. Githinji brought in this question of we're not calling them volunteers because they are working, and how do we bring value to this and shift this conversation really about how we're valuing health. And so I guess the conversation here is, to what extent do you see this as an opportunity, I guess, even for humanity or, our civilization? It's not just about responding to COVID. It's not just about better health care systems, as you've been telling us, Dr. Githinji, from the beginning. It's not just about better data, Mathilde, when you're talking about digital solutions. It's not just about tech. What do you think? Is there something in this moment that is also an opportunity for us as humanity to be creating a bit of a shift in the way we are in the world?
At the risk of speaking too much, I think really the shift has to be, let me frame this, that health, as I said earlier, is local. The global mechanisms only enable policies and drive advocacy for local policies that enable health locally. And even in the national government, health is local. It's not national. It is actually local. That's why in many countries, health is a devolved function. So when you devolve health, then you must also devolve the power to those people who are closest to decision-making. And I think the point around giving up our power is a really critical, important point in this conversation. And I tend to see that if you want to succeed in serving people, you serve them best when you hand over your power to them. Now, that is the conversation we need to have, that until we devolve the health system, not health care, The healthcare is part of the health system. The healthcare system is only part of the health system. You devolve the health system, including the healthcare system, devolve autonomy, financial autonomy, devolve accountability. And then once that accountability is devolved, then you start to build a better health system. And then supported by national accountability, international accountability, so that even when we go to the UN system, Laura, we carry this thing. When we are looking at the SDG framework, we have this thing we call the voluntary national reports. Note, underline, bold, voluntary. So countries just show up with what they want to show up with at the UN. But what if we put a mechanism where the UN system, which is the global system, and the national system asks for civil society accountability, that the reporting, that voluntary national report, the national report is actually an alternative report by civil society, not by the national government, because then the national government will only give its view from the national dashboard, not the view of those lived experiences. I think that's really the point I'm trying to make here.
Yeah, I completely agree with Dr. Githinji. I think we really need to continue funding, advocacy and civil society to really, be able to stand up and represent, the individual in the system, right? And so when we talk about this idea of, to answer your question, Laura, I think there is a moment right now where an individual could have a lot more influence over their own health, like what we've been saying. And I think, with COVID and everything, the new kind of technologies that have come about in this moment is really empowering the individual to be a lot more in charge of their own health. And I think as we now transition maybe back into the somewhat normal society, we need to continue being, ensuring that we as individuals and that our voices are being heard at that political decision making, at the top, whether it's global or national or whatever it is. And I think, for example, there's a big discussion going around now on health data governance. Like, how should we govern our health data? How should, who should own our data? Is it corporations? Is it, is it individual? Is it the national government or whatever? And I think that's an opportunity for us to really, as civil society, put the stake in and say, we as individuals believe that, we should have our own ownership to our own data. We should be able to decide how our data is being owned and used. We should, give the access to that data to who we want, to whoever we want to have access to that. So I think there's a number of things that we can really push for us as civil society, and I think we need to give an opportunity for civil society to really drive those conversations.
I fully agree with everything my panelists, co-panelists have mentioned here. I just want to kind of reiterate, there's such an important point, right? The level of analysis or unit of analysis being the community, right? Because everything kind of starts from there, ends there. And I think, how do you then devolve the power, the decision making, the governance, the partnership models, the funding mechanisms to be able to tackle those global issues at the local level? Right. So that means a new way of thinking, a new way of doing, a different mindset. And I think, the kind of environment that we're in at the moment allows us to kind of help shape that and drive that forward. And that's an exciting factor to be able to take away. And I think it does question roles. It does question where you play in the system, but at the same time, it also creates a lot of opportunities, undoubtedly, to see, how do we build forward to the next normal, because there will be shocks in the future, undoubtedly, and how do we kind of then, as taking that unit of analysis and trying to govern properly around that. Governance is something we underestimate in everything, because it is so fundamentally important, both at the global, national, local, and organizational level. But I think, we need to take a good look at that so that we're actually, set up to empower those local units, which are the communities that we're looking to work in. So absolutely, fully agree with my panelists here, and thank you.
Well, thank you so much, everyone. What a rich and deep conversation. And we're going to be wrapping up now. I'd love to send out the poll again for those of our participants who are with us. And just as we're wrapping up, also, as we said at the beginning, this is a big conversation, but a small group of people, and we've really seen this as a contribution to a much wider conversation that's happening in the world. And each of you have just touched on places in which this conversation is showing up for you. And I'd love to offer you the opportunity as we close to maybe signpost some of our other resources, other places the conversations are happening, something that you might invite people to go and explore as they come out of this particular time. So perhaps we can share the poll while we're doing that. And I'd like obviously to encourage all of us to go and dig a bit deeper by listening into the conversations that we've shared on the Futures Center, and you can do that. But I'd love our panelists to also just offer up a gift of where we might go next with this beyond the conversation we've had today.
I think if I can just speak very quickly to a new global moment that we're launching. We actually launched yesterday our website, Digital Health Week, which is it's a new global moment to champion digital health and its role in reaching health for all. So it's really an opportunity for everyone to come together as a global community and tell their story of digital health in a context and to commit to digital transformation of health systems. So anyone really working in digital health can take part in Digital Health Week, which is between November 29 to December 3rd. And during this week of action, we will, champion digital health. We'll discuss the barriers and opportunities to digital transformation. We will also work to highlight the work that the different organizations are doing and encourage and others to come in and join the movement. So if you're interested, please do get in touch, and you can sign up with the events or different things that you want to do during that week of action. And we would love to hear from anyone that is interested. I put the link in the chat here.
Thanks so much, Mathilde, and we'll share that too. Any other places we'd like to invite people to continue the conversation, or resources you think might be helpful for the people here? Dr. Githinji, did you have a final word or anything you wanted to share?
No, I think I would like to refer people to the conversation I had earlier on the Social Participation Handbook on the WHO website. I think it's an important place to start if you want to understand how communities can participate in this conversation. So please have a look at that. But as always, I cannot leave without telling all of you, please become vaccine equity ambassadors, because for you to create resilience in the communities we are talking about, they need to be vaccinated so that we can get back to social and economic life. So I'm urging all of you to individually become vaccine equity ambassadors, wherever you are, to your governments, to your any platform you find, any room you find yourself in. Thank you very much. And thanks, Laura, and to my panelists, fellow panelists as well.
Thank you so much. And Ben, a parting word?
Yeah, no, thanks to fellow panelists and to you, Laura, for shepherding us through this session and to all the questions we got in. I think, keeping these type of dialogues open will be so important for the future. I think to everything that's been mentioned here today, huge challenges, but huge opportunities. We can solve them together, but that means we need to maintain an open dialogue and make space for it. I think, we're also very guilty of looking inwards always. I think, being vulnerable, going out there, speaking, getting the feedback. I think, if anybody wants to give us feedback on what we're doing and how we can play differently, please let me know, because we're really looking to improve the way we do everything at the moment and taking this period in time to do so. So a big thank you for the great conversation and active participation. Thank you.
Thanks all, and we've heard that about 60% of our participants today felt that their mindset had shifted slightly about how they think about this question. So the power of conversation as well to move things forward. Thanks all. A final invitation to go back and look at the other dialogues and also keep this live. And we will be publishing our report with some of the insights from this conversation and the others as well shortly. So we'll keep an eye on this resilient health future all over the next few weeks. Again, very warm thanks to all of our panelists today.
Thanks so much. Bye now.
Thank you and bye-bye.
Thank you.